Started?
Yeah.
Okay. Hello, Cecile. I'm Alexi. I'll be a massage therapist today. Hello, Tanya. So, this is how it would look like if it were an actual treatment. I would walk in with the client. I'd ask them about what they're in for today. I'd ask them how they're doing, what are their symptoms, and I'd just ask them what they're in for. So, what are you in for today, Cecile?
I fell on ice on my butt like 4 weeks now, but I'm still tender. I'm having pains in my shoulder blades up to the front and back, and goes up all the way to the neck here, and also my sitting bone.
Did you have any of these discomforts and pains in your shoulder before you fell on the ice?
Yeah.
Okay, so then we can assume that these are chronic injuries. Have you had shoulder pains for over a year?
Well, on and off.
On and off, so we could assume that it's chronic. Okay, but the hip pain is new.
Yeah, fairly.
So the hip pain, since 4 weeks, we'll still treat it as subacute, so we might want to be a little bit more gentle. So just the shoulder pain and the hip pain, correct, Cecile? Okay, so this is when the testing begins. So what I can do is I can get Cecile to come towards me and get her to just do the empty bucket test. This will rule out any impingement syndromes or just tendonitis the supraspinatus. So you have your arms like this, and twist them in like this, and I'll bring your arms up and resist against me. Any pain?
Yeah.
In the left one? So she tested positive for the empty the bucket test. So then we want to do, so then we can rule out to do the supraspinatus test, which oftentimes, most of the time, will test positive if the empty the bucket test is positive. So we'll just do this one again just in case. So now externally rotate your arm and resist me. Any pain?
Yeah.
Okay. And then we'll do the infraspinatus test. We'll have her like this. And then we'll go like this. Resist against me. Any pain?
Yeah.
Okay. So positive, we can assume for supraspinatus, infraspinatus, and then have you look at me. We'll get her to look at me, like face towards me. We'll have her to straighten out her arm straight. And your right shoulder's not bugging you, right?
No.
So then since your right shoulder's not bugging her, we don't have to do all the tests on both shoulders. So keep your arm straight, and what you're going to do, you're going to bring your arm up like so, but you're not going to curl your arm. You're just going to, okay? So have your arm like this, and then tell Cecile to lift up her arm and resist against you. Any pain?
Yeah.
So then this, we can assume, we don't tell the client because we can't diagnose, that there is an issue with the bicep tendon long head, which runs into the shoulder. Oftentimes when this muscle gets too tight, and if there's any tendonitis from the bicep tendon, it will only be in the shoulder. So they'll say, oh, my shoulders hurt, my shoulder hurts, my deltoid is messed up, but it comes from the bicep. If not the bicep, then any other of the rotator cuffs, most of the time. And then we can do one more just to be safe. It's also a rotator cuff muscle. We can do a subscapularis. Exact same thing, exact same test as the infraspinatus, but this time internally rotating. So you get Cecile and show her how to internally rotate. Keep your elbow tucked and just internally rotate against my resistance. Any pain? Some pain? So she tested positive for the empty the bucket test, the supraspinatus test, infraspinatus test, the bicep long head, and the subscapularis. So this could be either just overall tendonitis, this could be calcific tendonitis in the shoulder capsule, or this could be an impingement syndrome of any one of the four, which is already pushing up against all the other tendons. We got to remember there's very little room in there if one of these tendons is already inflamed. So that's for the shoulder. Are you having any neck pain, Cecile? Tightness. So she's right away showing me on her traps. Okay? So get her to just turn around. And this is a test that I like to do. It's just very simple. Cecile, bring your right your right shoulder to your right ear to your right shoulder, like this. Sorry. Just
yeah.
Okay, and note what angle and what degree her head is at, and then do the other side. So on the right hand side we have let's see. Yeah, on the right hand side she has great range of motion, so her left trapezius was shortened. So we already know there's some hypertonicity in this trap. Further, no more do we need to test. Okay, and just turn around. And so it's just the trap area, the shoulder area, and then the hip, right? Okay, so for the hip, there's not much we can do standing up. these are more tests that we will be doing as they're laid down. So that would be the piriformis test, the gluteus medius and minimus strength test, and some other ones. So what I'll do, I'll give her my plan on what we're going to be doing. So in this case, I'll say to Cecile, okay, Cecile, so what we're going to be doing is we'll have you face down in between the sheets. We'll start at your back, we'll start at your neck, we'll work your lower back, and then we'll warm up your hips. We'll do some subscapularis work while you're face down. We'll warm up your shoulder and your traps. And then as we get down to the hips, we'll work on your gluteus medius, your minimus, and then but before all the actual deep work, we'll do a couple tests. So it doesn't require you much other than just to lay down and we'll do the tests. We'll work on your glutes, we'll flip you over, and then we'll work from your neck. And then from your neck, we'll work down to your shoulders, and then we'll focus on the left shoulder that has been bugging you. We might even go down to your arm a little bit because it might be connected with your bicep. Does that sound like a plan?
Yeah.
So you just give her the plan, you tell her about the tests that you're going to do once you come back into the room. You can also ask her if she needs heat, or you ask her, is it okay if I use heat, if you feel like it's appropriate for the treatment. In this case, I don't think we really need heat because I'm going to be getting into the shoulder right away, and the hip is still not quite into the chronic stage. So I'm just going to let off the heat. But we're going to ask her, do you want heat, perhaps for your feet? So we're going to get heat for her feet just so she stays warm. A lot of clients get cold on the table. So now this is when you let her undress, and then we leave the room, and we go from there. Okay, so how do we pause it? There you go, Tanya, with the napkin, don't worry. So then, let's say I walk back into the room. I have my heat, I have my bottle. First thing I do, I tuck in this little stepper. I walk around. I put down the bottle. And I leave the heat beside her feet for now. I ask the client, how are the pillows? How are the pillows, Cecile?
Well, you can put them a little more
Low?
low, yeah.
Okay, adjust it to the client's comfort. Like so.
Yeah.
How's the pillow up on top?
It's good now.
How's the headrest?
A little, can you just bring it down a little bit?
Sure. So then with the towel, you can adjust the headrest. How's that, Cecile?
Better.
Now with that same towel on the other side, you can use it as a shubka. Can I put a towel over your head? A babushka, I should say. That way I avoid getting grease in your hair. And then once she's all comfortable, this is when you start doing your tests. Since we are working on the hip, she has general hip pain, we can assume that there could be some hypertonicity or perhaps trigger points in the piriformis. The trigger points are quite local, so something we want to assess. So we can start off with just the classical piriformis length test. Well, you bring her feet up, you ask the client to bring her knees in together. Bring your knees in together there, Cecile, and then you just bring them out to the side, go to the back of the table. So in this case, this one's a little bit shortened. This one, I mean, they're both shortened, but this one's more so. So the piriformis can be worked on both sides in this case. There's also gluteus minimus and medius tests that you can be doing, but that is not too necessary. Okay. Grab your heat, put it at her feet, over top of the sheet, and then with a blanket cover it up so the heat is not lost. So that way your client can stay warm. And this is especially good for clients who don't have tables that are heated. So most of your discomfort is in the left-hand side, ACCL.
Mm-hmm.
So right now what I'm doing, I'm spreading the oil. Also, I'm assessing if I find anything. And since this is the area where she tested positive for, really want to assess in there. So we're going to assess in the infraspinatus, the supraspinatus, perhaps even the latissimus dorsi area, the traps, the upper traps, I should say. And then once you start increasing your pressure just a little bit, once you already found what you're looking for, then you can start asking the client, how's the pressure? How's the pressure, Cecile?
Good.
We can use a little bit more?
Yeah.
Alrighty. So increase your pressure a little bit, if client permits you to do so. Can maybe assess a little bit more on the other area of the shoulder. So if you want to work the parascapular muscles and the muscles surrounding or attached to the scapula, such as the rhomboids, I would recommend for people that are, let's say, if they're bigger or if they have shoulder pain. For instance, Cecile has shoulder pain. So me trying to get into the rhomboids, the ideal position would be her hand behind the back. But oftentimes people who have shoulder pain or impingement syndromes, this hurts the shoulder. It pinches right in the anterior delt area, especially when you start pressing up and down like this. It's uncomfortable for them. So let's say if Cecile does have pain from this position, what I like to do is similar, but just off her back. And then you can go like this. So right here I can see there's some popping of her scapula. That looks like a good spot. Maybe let's try right here. That seems like a good spot. And the spot that has the most, I guess, has the jackpot of where the scapula is revealed, then you remain on that spot. So this one right here looks like, yes, I can get, a lot of room to work in there. So I'm going to stay on this spot, and then I'm going to start working my way in there. And then I'll be pressing on her elbow like this because it opens it up like so. So I can go in with my fingers, then up with the scapula, in with my fingers, and then down the elbow like that. It's kind of technique that I thought of to still get in behind the scapula for people who have shoulder pain. And then you can go from here, from this end as well. So now I'm just with the thumb, and I'm just going over, feeling for trigger points, and then I'm pressing up and down on her elbow to reveal more of that rhomboid. And then what you can do is, while you're pressing down, you're almost stripping up the rhomboid like this. This is a technique that I kind of thought of myself. It's all, I guess, alternative to what we've been doing, but just for more people with discomfort in the shoulder. How is that, Cecile?
You're good.
Is it still rolling? Yeah. Try to deviate your wrist here. So for example, right here, I'm starting to deviate just a little bit on my left wrist here. So if that's so, get a little bit closer. That way you can straighten up. And then if client needs more pressure, Cecile always likes a little more pressure, you could even go with your elbow like this. And same thing, going in, then up by pressing down on the elbow, in, up, and then you're just doing that. Up and down, up and down. Yeah. So there you go. Cecile says we found a good spot. So stay on there a little bit, go up and down, move the elbow.
There.
Yeah. And then up, and then.
It's that whole side there. I can feel it.
Alrighty. So we'll get in there again. And get in there. And then you worked your rhomboid pretty good. You can move your hand off the table like so. Look at some of the other muscles in the scapular area, perhaps the teres major or minor, and the latissimus dorsi, see if they're tight. We want to release some of these other compensating muscles before we get right into the rotator cuffs, in my opinion, of course. So yeah, her lats have some hypertonicity. I've seen ranges much greater than this before. So right here is my end field. Perhaps you can even change the hand position. Go like this. Once you get greater range, you can switch positions and then go right in there like this. So now I can lift up her hand a little bit more. There you go. So let's see, not too bad, but we'd want to get a little bit higher ideally. What you can do, you can tell the client by pressing down on your hand where her elbow is and try to bring her hand down. So see, if you want to just resist against me on this side with 10%, take a nice deep breath. And as you breathe in, breathe out, relax. And then you try to find the new end feel for her lat. Again, this is a new end feel. Tell her to press up against you on this side. See how her lat is contracting there? Take a deep breath in, and as you breathe out, relax. There you go. So let's do it one more time. Watch this area, how this area contracts. So press down on my hand with your elbow. See, there you go. And breathe out, relax. There you go. Her shoulder is now touching her ear. That's a good, safe zone for the teres minor and major and the latissimus dorsi. So now, the rhomboid is released, or at least worked on. Latissimus dorsi, teres minors and majors have been worked on. Now, we can get in to some of these rotator cuffs. So, we can start off a little bit by infraspinatus, supraspinatus. With infraspinatus, we can go like this. We can go shooly a little bit. Do hearts, just to warm it up. Go down like this. Down tricep. There you go. And then work underneath the scapula. This is the fun one. Underneath like this. Support your thumb if you can. So now you warmed up the subscapularis to a degree. Get on your knees here like this. Press deep in there. Try to find a trigger point. You can even go like this and move around her arm up and down to see if you find trigger points. So say you found one right there. I can feel a good one right there. You're going to instruct Cecile to bring your arm up like this, slowly. Okay, so I'm going to press down on that trigger point, protect my thumb, and then instruct your client to bring her arm up superiorly, anteriorly, superiorly. All right, give her, Cecile. Tender?
Mm-hmm. They're close to the spot, but not spot on.
Alrighty, then you adjust a little bit. Try to hook a little more underneath the scapula. Alrighty. And then have the client do it again. Ask your client again, how is it? Am I on it? Does it feel good?
Yes.
And if you feel like you're still in a good spot and it's not released, do it two more times. There you go. You gotta remember there's more than one trigger point there, so you can always adjust. And one more time, Cecile. And there you go. So this is a great technique. We learned it for frozen shoulder. So although frozen shoulder is quite idiopathic in nature, this is still a very good way to prevent it from freezing. So I think there is a good link with people who have had shoulder injuries in the past, and it can lead to frozen shoulder. But that's besides the point. The point is that it is a trigger point for the subscapularis, and she tested positive for the subscapularis test. So it is very appropriate for us to dig in there and do that technique. So now you can do a little bit more on the Infraspinatus, supraspinatus. Work down the tricep because we know that one of the tendons in the tricep does attach to the scapula. So since right here, might as well. This is what it looks like right here, like that. You could even do a little bit of pin and stretch by moving. You can't really see me, but what I'm doing, I'm moving the arm underneath the table. That way we lengthen the tricep muscle as we pin it. We can even go nice and flowy down like this.
That's a little tender there.
In the tricep?
Yeah.
Where? Yes?
Yeah. Go down to there.
That's where you want me to work on?
Well, it's just a little tender, but it's okay.
Okay, do you want me to work on there?
Sure.
So if the client says that you found a tender spot and she wants you to work on there, stay on there just a little bit longer.
There.
You could do, if it's something particular, you can even use your thumb. Bring up the arm, so I'll have the arm like this. Press on that trigger point, and then bring it down. Pin that trigger point. Press on it, bring the arm down. It's a nice pin stretch technique. And then finish it with a little bit of Julie. You don't need to look for a nice big stretch move, for we were doing that as we were doing the treatment.
Mm-hmm.
Getting the traps a little bit there. Now start warming up the QLs. Since she said she has hip pain, we always want to shoot for the QLs. Nice. Tender there?
Mm-hmm.
So I found a trigger point right underneath her 12th rib, or QL. So what do we want to do to really get in there? We want to lengthen the muscle. So this is what I like to call the banana position. So Cecile, if you can put your legs to the right hand side of the table and basically make a banana with your body. Now we've opened up the area. The ribs are now raised superiorly and the iliac crest inferiorly. Now we can really get into that trigger point. So protect your thumb.
Mm.
And then you ask your client, what is your pain from 1 to 5?
This is 2.
Okay, what about now?
Still at 2.
Oh, geez. Cecile likes pressure. Okay. What about now?
It's not right there. No, no. Go higher. There.
And what's the pain?
Like 3.
So once you get to 3, 2.5 is even good. You ask the client to take nice deep breaths through her belly, diaphragmatic breathing. Alright, so you want to take nice deep breaths. And make sure you remain the same pressure.
Better now.
It's gone now? Alright, now Clan says feels better. Do moves that support the stretching, that further add stretch to the muscle. So this is what I'm doing here. I'm pressing further the iliac crest down, like this. Pressing it down like this. Do the same by pressing the ribs up a little bit, just pushing them up a little bit. And then what's the best is like this. This is the one I like the most. So what I'm doing here, pressing the iliac crest inferiorly and the 12th rib superiorly. So I'm doing like a cross hand. And then go like this. And then cross hand. Cross hand. Really stretch that muscle post trigger point. Alright, Cecilia, you can put your legs back to normal. And then you can do a little bit more on the other QL. Up and down, up and down. But since she's not having too much issues with the right hip, I wouldn't focus much on it. Now you want to use your towel when you want to dress in the blankets to see if you have oil on them now. I am going to work first on her right hip, just while she did test positive for the piriformis test, and because I want to see what the norm is a little bit. What we're doing, we're warming up the area. And then ever slightly with your thumbs, you can start assessing for any trigger points. And make sure you're far away from the US-Canada border. And make sure you're always pushing this way, not towards you. You don't want to start a revolution. Make sure it's nice and flowy. Almost make it like a rhythm. So what I'm doing is elephant walk. 1, 2, 1, 2, stop, stop, elephant walk. Right here I can get away with having my fingers spread out because it's under QL, but as I get lower to piriformis, I'm going to put my fingers like this, just to not have my name in the newspaper. So she's complaining about hip pain. We'll still want to work into our gluteus medius and minimus. We can bring our leg down like this. We can press on those muscles and bring the leg in medially, I should say. Medially. And then we can get into the piriformis. How is it there? Tender there, Cecile?
Not really, no.
Yeah. How about there?
Just a little.
Just a little? So for the piriformis, it's laterally. For the glutes, it's medial. Bam. Whoa, bam. Bam. And even in this position, you can, even over the sheets, take your fist, put it on your IT band, and bring the leg medially. Work into the IT band just a little bit. Nice and easy. And as you warm it up, you can increase the pressure. Some people like elbows in their IT band. Cecile likes elbows in her IT band. Would you like me to use an elbow?
Sure.
Make sure your arm is up so you're not going into your crotch. Alright, and not to waste too much time, what we can do is move on to the next leg. You see that her hip is going up as you're trying to push it down and it's not anywhere near her glutes, her heel. You can tell after the client that she has shortened quads and that she could perhaps use some quad stretches because that could all be contributing to that hip pain. There you go. Again, elephant walk, always pushing this way. And the way you drape the blanket is try to drape the blanket just a little bit past the US-Canada border towards you, so then you know where not to go. You can start losing a little bit of your thumbs in here, like this. See if you feel any trigger points. Let's start on the gluteus medius and minimus with your fist like this. And bring the, I don't know if you can see, the leg like that. There you go. Bring the leg medially, press down. Right. Try to use your core if you can. Keep your wrist straight. Stand on that spot, Cecile?
More medially.
More medially, okay.
Closer to the sacrum.
Okay.
There.
You there?
Yeah.
Okay, so when you find a really good spot, is there?
Mm-hmm.
Okay. You can instruct her to do the exact same thing you were doing with her leg by bringing it medially. So just go like this, Cecile.
Mm-hmm.
So start here and do that.
Okay.
Do it right now.
Yeah.
Do it right now. And bring it back. And that's what you're going to instruct her to do while you're pressing on that trigger point. Right there.
Bring it a little bit lower.
A little bit lower.
Uh,
Okay, 1 second.
there.
Yes, a little bit high. Okay. So you press on the trigger point and then have her move her leg. This is in essence active release therapy.
It's gone.
It's gone? Okay. And then
There.
here?
Yeah.
Okay. Do a little bit more when you found another spot, because there's several trigger points in there. And then move down a little bit towards the piriformis area.
There.
Okay. Bring the leg out laterally. Then ease off the pressure. Bring the leg back laterally and bring on the pressure again. Same thing you can do. You can press the trigger point, protect your thumb, and have the client herself bring out her leg laterally. So you want to do that for me, Cecile? And then back, of course. And then this is another form of active release. This is the one that you actually taught me, Tanya, when I asked about my dad's issue. When I said that it feels like I'm pressing on his nerve. This is a good technique to do. I think this would be also a good technique for people who need a lot of pressure, and elbow is not an option. For you can use both your hands now to protect it without just ruining your thumb. And instead of you pressing the leg laterally, they do it themselves actively. And after some nice trigger points, you can finish off with a little PIR. You can put your hand right here and look for the end feel. Ask the client if this brings on any pain to the hip. Does this hurt your hip at all?
No.
Okay. Instruct your client to press up against you with 10% of their force. All right, Cecile. And start to take a nice deep breath in. And as they breathe out, to relax the muscle. And fine and new. Look at that. Already dropped some. Let's see how much further we can go just in this video. Alright, press up against me. Take a nice deep breath in. Press up against me, Cecile. Okay. Okay, let's just start from the start, okay? So press up against me with 10% of your force. Take a deep breath in. And as you breathe out, relax. Okay, put it down a little bit. Alright, press up against me again. Take a deep breath in. And as you breathe out, relax.
I can feel it.
A little bit of discomfort?
Yeah.
So if this range of motion is too great, this does happen often. They get discomfort in the greater trochanter area. So, we already, got some new range of motion, so should be satisfied with that. We'll put the link back down. I guess we could finish with a little bit of IT band work. Would you want some IT band work there? Same thing. We can go like this. Start off with a little bit of pressure. Bring the leg in medially. And for the clients who like the elbow. Alrighty. Have your clients to scooch down and flip over. Alright, Cecile, if I can just scooch down and flip over. How are the pillows? Do you want me to adjust them?
Yeah, they're good.
You good? Okay. Ask your client to tuck her hands over the sheets. This is what I do. Alright? I can just get you bring her. That way you don't risk anything. Like that. Perfect. Then you walk back. And then with your towel you can bring this down. And the oil's right here. And then with your babushka sheet, you can ask them to put their head. There you go. So, we really want to focus on the traps. In this area, the upper traps, I should say. So now bring her head to the left hand side, and then with your fist, try to push down on the shoulder just to stretch the traps a little bit. And then Julie in the traps while they're in a lengthened position. Like this. And stretch. Work in there. You can even pinch her just a little bit. So that's the right side that we're doing for now. And then we can move on to the left side where it counts. This is where we were tested positive for shortened upper traps. And everything I did on the right side that you guys seen, I'm doing on the left hand side. Just focusing on it a little bit more. It's just longer for this is the side that was shortened. Oh yeah. Find a nice good spot, stick on there a little bit, and play with it. Do a little bit of range of motion with your head while staying on that spot. We need to listen to some gossip. Yeah. Oh yeah. So we're just on a nice juicy spot. I'm gonna press on it, and then I press on it. I'm bringing the leg towards you guys, the head towards you guys. Back to pose. So working to the shoulders from here a little bit. one trap.
That's the
Tender.
there.
So you guys can't really see what I'm doing on this side, so I'll go around and I'll show you on the right hand and shoulder what I am doing.
There. Feel that?
Oh yeah. Okay, now you yourself bring your arm down while your palm is up. Slower to seal. Up. And down. Up. And down. Alrighty, I'll show you from start to finish what I was doing on the left side. So as I got up, I was massaging our traps like this. Traps are shortened and they're all connected. Then down the arm I went, because down the arm I'll be working. Got into the bicipital groove. That's where I'll be working the most, is right in there, right in the bicipital groove. So, I don't know what's the best way you guys can see me. I'll try to, yeah, like, I guess you guys can kind of see me. Okay, so I'm in the bicipital groove, and I'm just loosening up a little bit, and then side to side with the arm, I'm going like this while I'm pinning the tendons in there. We want to work a little bit in the bicep tendon, and since we identified this as a chronic injury to the shoulder, we can allow ourselves to do techniques that are similar to frictions. So this in a way is, we can bring the arm up like this, press in the bicipital groove, and bring it down. Up, down. And then we can go like this. I like to do all these ranges of motions because a lot of people who don't have good range of motion with their shoulder, they do when we do it to them. It's just when they do it actively is what hurts because it tenses up all the tendons. The tendons start working on the muscles. So it's good to introduce some range of motion passively. And then down the bicep I go. Here I am down the bicep. Warm it up with the fist first of all before we get into any specific like work with the thumb. We really want to work in the bicep because the bicep, as I said, bicep tendonitis oftentimes looks as just simple shoulder pain, or people just say, well, they could call it deltoid pain or whatever, you know, and it can fall underneath the categories of impingement syndrome because it does lie in the shoulder capsule. So she did, but that doesn't matter anyways. Point is she tested positive for the bicep tendonitis test, so we're going to work in the bicep. We're going to have our thumb right here, lower end of the bicep, for those where the 2 trigger points lies. We're going to press on it, and then we're going to pin and stretch it. We can do a little more pin and stretches on the superior part of the bicep, for that's where the tendon will lie, or will start, working into the bicipital groove. And that's where she's having some pain and discomfort. That's where she had on the other side. We can even do it actively. Keep your arm up, Cecile. We'll press down like this. That's what I was doing on the other side. And she'll put her arm down with her palms facing up. And the reason why I say palms facing up, because if what people like do, they'll start to go like this right away. And what this does, it moves the bicep in a different position, and it more so opens up the brachialis. The brachialis is not what we're focused on, it's the bicep. So palms up is the rule of thumb. However, as we get lower, we go down to the brachioradialis. Now, why am I working the brachioradialis? Well, as the legends have it, if your bicep tendon, which lies in your shoulder, is in pain, as Tatiana Alexandrovna has taught us, if it were tendonitis, we always want to also treat the distal tendon, so the opposite end of the tendon. So in this case, the opposite end of the tendon will lie right in the forearm here by the elbow, right where the brachioradialis lies. So if we can loosen up that muscle, in essence, in theory, what legends say is that it will release the brachioradialis, which will avoid any hypertonicity being pressed up against on the distal end of the bicep. Therefore, the bicep itself should, go into a more relaxed state, and therefore, the proximal tendon, which lies in the shoulder, should also be in a more of a relaxed state. So there you go. Do a little bit of brachioradialis work, pressing on the brachioradialis and bring the arm down. This time it's not palms up, it's palms down, it's palms like this, palms to the side. And then we finish with the rest, just like so. And there you go. Grab your sheet, dry her off, and that is so. So when the massage is done, when you see her outside, you could say, "Well, Cecile, there's a couple things that you can do. First of all, we identified that your quadriceps are short. We can say that you should be exercising your external rotator cuff, so we can try to push the shoulder back. We can tell her to stretch her pecs to avoid bringing the shoulders forward. We can also tell her to even stretch her latissimus dorsi, for we've seen that was shortened. We can give her some stretches for her hips, some exercises for her hips, and we can explain to them about posture and why posture is so important. So this is often what I see. Anybody who has any kind of impingement syndromes, same way that you explained it, I tell them there's two bones that lie, and underneath them there's bursas, and in these two bones lies 4 tendons. 3 of them are rotator cuffs and 1 of them is the bicep tendon. And as your posture closes in, these bones come closer together and they pinch off in between those tendons and those bursas. And if even one of them were to be inflamed, it would take up the space in there, the space that already is tight because of poor posture. Now it'll start pressing up on other bursas, on other tendons. So even if you have one tendon that's inflamed out of any of those four, you can start pressing up on the other tendons. In theory, this could be why she tested positive for all four of her tendons, that being subscapularis, her supraspinatus, infraspinatus, and the bicep tendon. So I would really emphasize for them to work on their posture. I would tell her to keep her sternum up, keep her pecs loosened up, and if she goes to the gym, to really focus on rowing exercises to strengthen the rhomboids to keep the scapula in place. And you can also advise her for some trap stretches. Yeah, I could show you, but my hands are greasy. And perhaps even some bicep stretches. But again, most important is posture. And I would tell them, I'll give them another example how, let's say if you're a sander or a painter, and oftentimes they come in and they have, oh, I have impingement syndrome, I have delt pain, I have shoulder pain. And then they work and it's like, oh, it hurts to put my hand above my head. I would tell them that a lot of these clients, as soon as they bring their sternum up and pull their shoulders back, all of a sudden the pain is magically gone. Why? Well, because those bones have now more space because the shoulders are pulled back. Now there's more space for those tendons to be free. Now they don't have that impinging. I think this really catches the attention of a lot of clients, and I think it works, and it makes them come back, I think, because you're not only treating them, you're educating them. And education is big. I tell them posture is very big. All right, well, thank you, Tatiana Alexandrovna. Thank you, Cecile. And that is that. Like when you tell. And thank you.